technology. So we're going to go ahead and do some tests. So if everybody could just raise your hand, it should be under the My Status at the top corner, just to make sure that everybody has that ability. And it looks like people are able to raise their hand. That's great. Okay, so I'm going to go ahead and lower everybody's hands. So throughout the presentation, our presenters may ask you to raise your hand if you've encountered something like this, and that's how you would do it. You can also use the public chat to let us know if there's anything that you want to talk about, ask any questions, issues like that. And then we'll have some feedback questions for you, some polling, and we'll go over some of those examples in a moment. If you're having any issues at all, please don't hesitate to send a private chat to me, Laura Kikuchi, so that I can help you. You can also call iLink Technical Support. Their number is there, and I will put the number in the chat box in just a moment. So before we begin, we're going to ask for some feedback. So let me put this up. If you could choose A, B, C, or D to tell us what your profession is, A is victim service provider, B, aging services provider, C, criminal justice profession, and D, other. And if you can go ahead and let us know how many people are participating with you. If you have more than one person on your screen in the chat box, you can give us an introduction and let us know how many people are watching with you. Great, thank you so much. And I'll give people just a few more seconds to respond and continue to type in throughout this presentation as well. Okay, great. Looks like we have a lot of people on our webinar, which is wonderful, and a lot of different agencies represented. The majority seem to be victim services providers. But then we have a few aging services providers, some criminal justice professionals, and others, which look like coalitions, investigators, project management, TA providers. So it looks like a great group, and we're really excited for this webinar. Okay, so I'm going to move on. And now we have our presenters. First we have Hima Khan, who is our program attorney for the National Stalking Resource Center. And let me just go ahead and unmute her microphone so she can do an introduction. One moment, folks. One moment. I seem to be experiencing some technical difficulties. 1 second.
Good afternoon, everyone. Can everyone hear me okay? We were having a few technical issues, but hopefully we should be able to get past those. My name is Hima Khan. I am the program attorney for the Stalking Resource Center for the National Center for Victims of Crime. And just to give you all a little bit about my background, I started my work as a victim advocate for victims of sexual assault and relationship violence at the University of Arizona. And after that, I did my JD at the University of Arizona in Tucson, Arizona. And I graduated in 2004. And since then, my practice has focused on both criminal law and international law. And I started my work with the Stalking Resource Center in January of 2012. And now I'll turn it over to Linda Dawson to introduce herself.
Okay, Linda.
Good afternoon, everybody. My name is Linda Dawson, and I'm the Elder Justice Coordinator with the National Clearinghouse on Abuse in Later Life. We're a project of the Wisconsin Coalition Against Domestic Violence. My office is located in Madison, Wisconsin, and we do work nationally with the abuse in later life grantees across the country, along with other TA providers on the area of elder abuse and abuse in later life. My background is I'm a former prosecutor. I was a prosecutor for about 10 years in Dane County, Wisconsin, focusing on domestic violence cases. I also was a regulatory attorney with the Department of Health and Family Services, now the Department of Health Services in Wisconsin, and I was in private practice doing civil law as well. I've been with NCAL for about 4 years, and I focus on the justice system. So I work with prosecutors, law enforcement, judges, and civil attorneys.
Okay, Hema, if you want to get started, we can go ahead and get started.
Okay, great. Okay. Again, thank you everyone for joining us this afternoon for this webinar. I want to start out with giving you all a little bit of an overview of stalking, but before I get into that, I would like to get an idea of the experience that our participants have in working in stalking cases. So what I'd like to ask the participants is, have you previously worked with a stalking victim? And if you could please use the raise your hand feature if you have. Okay, so it looks like we have about half of the participants who have worked with a stalking victim, so that's great. Now I want to start out with a definition of stalking. And at the National Center for Victims of Crime and the Stalking Resource Center, since we train on a national level, we have come up with a working definition of stalking that we use in our trainings. Stalking is a crime in all 50 states of the U.S. However, every state has a different definition of what stalking is. So in order to train on a national level, we have to come up with a working definition of stalking. And that definition is that stalking is a pattern of behavior directed at a specific person that would cause a reasonable person to feel fear. Now I want to break down that definition a little bit for you. First of all, stalking is a pattern of behavior or a course of conduct. So it's going to be repeated behavior that is repeated over and over again, and in order for it to qualify as stalking, it's usually going to be 2 or more incidents. One incident, however severe, is not going to be enough to qualify as stalking. And what's particularly interesting and also complicated about stalking is that the individual stalking behaviors that a person experiences may not be illegal behaviors in and of themselves. So for example, and we will be talking a little more in detail about what behaviors are actually stalking behaviors, when we think about the typical stalking behaviors, things come to mind are calling somebody a lot, or sending a lot of text messages, or sending someone a lot of emails, or maybe even sending them gifts, or showing up at places where the victim might be. All of these behaviors in and of themselves individually are not illegal behaviors, but when they are done together as a pattern of behavior, as a course of conduct, they become stalking, which is a crime. So because these behaviors in and of themselves may not be illegal behaviors, it can be very difficult for the victim who is experiencing them to actually recognize the pattern and recognize it as stalking behavior. Now, looking further into the definition, a pattern of behavior directed at a specific person that would cause a reasonable person to feel fear. What we have to ask in stalking cases is, would a reasonable person in the victim's shoes feel fear? We have to look at that fear from the victim's perspective, because all of us have different levels of fear and we all have different things we are afraid of or not afraid of. And also, context is going to be absolutely critical in stalking cases, because certain behaviors that may seem completely benign to an outsider, to the stalking victim, it could be very threatening or terrifying behavior. So for example, to the average person, receiving a dozen red roses may seem something that's a very happy occasion. It's romantic, it's sweet, it's a source of great joy and happiness. However, if we look at that from a stalking victim's perspective, if a stalking victim receives a dozen red roses and she has been told by her perpetrator or offender that the day you receive a dozen red roses is the day you're going to die, or if she has been moving from state to state trying to get away from her stalker and getting those roses is a sign that he has found her, that can be particularly terrifying and devastating to that victim. So that's why when we look at stalking cases, when we look at fear, when we look at the individual stalking behaviors, it is really essential to remember that context is absolutely critical in these cases. So now let's move to how often does this happen and what is the prevalence of this crime in the United States. So I would like you all to answer the following question: how many people are stalked in the United States in 1 year? And this is just what your guess is. And please use the feedback box on the left of your screen to select one of the following choices: A, 850,000, B, 2 million, C, 3.6 million, or D, 6.6 million. Okay, so it looks like we're getting varied responses, but it looks like people are mostly answering C, which is 3.6 million. So it's sort of a toss-up between C and B at this point, so 2 million or 3.6 million. Well, the correct answer is that 6.6 million are stalked in a 1-year period in the United States. Now, this statistic is based on the most recent data and research that we have on stalking, which was done by the Centers for Disease Control in their National Intimate Partner and Sexual Violence Survey, and this report was released in 2010. And a link to this report is actually available on our website as well if you're interested in looking into the report and doing further research into it. But the 6.6 million number breaks down to 1 in 6 women and 1 in 19 men will be stalked at some point in their lifetime. Now, a couple of things to point out with this report. One, the people who were surveyed, and there were around 16,000 participants, they were all 18 and over. So this survey was only done on adults. The other thing to consider is that the definition that they used of fear was a very conservative definition. What they asked participants was if they felt very fearful or had concern that harm would come to themselves or someone close to them. So they used a very conservative definition of fear, and with that definition, the 6.6 million number, or 1 in 6 and 1 in 19 men, was deduced. However, victims of stalking are going to vary in their level of fear. and some victims will report more fear or less fear. So with the NISFIS, when they used a less conservative definition of fear, when they asked the victim or the participants if they felt any amount of fear, that number actually increased. So it was actually 1 in 4 women and 1 in 13 men who would experience stalking in their lifetime. Now, the NISFIS also showed other dynamics. One was that women are more likely to experience stalking victimization. However, the reality is men also do experience stalking, and throughout this presentation I will be referring to the victim as she and the perpetrator as he. However, I do not want to take away from the fact that men are victims of stalking, but based on the research that we have, women are more likely to be victims of stalking. Most stalkers are male. However, men are equally likely to be stalked by a male or a female. And what this is coming from is new male intimate partners of women who are already being stalked by a male stalker. So if a woman is being stalked by an ex-partner who is a male, and she is now involved with a new intimate partner who is a male, that new intimate partner may also become a target of the stalking of that stalker. And the majority of victims know their stalker. In fact, the NISFIS found that in most cases it is the current or former intimate partner who is doing the stalking. Of course, acquaintances, strangers, family members, or persons of authority like a boss or supervisor or a clergy person can also be perpetrators. But in most cases, it is the current or former intimate partner. Now I want to talk a little bit about the age of the victims in the NISFIS survey. These are two charts based on age at time of first stalking victimization. And the chart on the left shows female victims, the chart on the right shows male victims. And you can see the number in particular for 45 years and older. For women victims, it's 6.6%, and for male victims, it looks like it is around 13.8%. Now, what's important to consider with these charts is they are only looking at when the stalking first occurred in the victim's life. So if, let's say, a victim started being stalked in her 20s, and then she was being continually stalked into her 50s by the same offender, this chart would put her in the 20-year-old range, so maybe the 18 to the 24-year range. If an older victim who was, let's say, 55 and older was being stalked, but let's say that victim had also been stalked at the age of 23, this chart would still put them at the 18 to 24 range. So it is the first time you experience stalking in your life, even if you experienced it again at a later age. This chart would only show that first victimization of stalking. Now, this next chart talks a little bit, gives you a sort of a picture of the age of stalking victims. The age range of 18 to 25 years is the age where victims are more likely to experience stalking. However, stalking can be experienced at any age, and as you can see from this chart, the age range from 50 to 64 or 65 and older also are showing percentages. Now, what's interesting is with older adults, it can be even more difficult to recognize the stalking behavior, and there can be additional barriers to reporting. For example, if you are being stalked by a family member or someone who is taking care of you or someone who is handling your finances, or if you are being stalked by an intimate partner or a new dating partner, all of those can be situations where that older victim may not report, may not recognize it as stalking behavior. So in that older adults group, it can be a lot more difficult to recognize that stalking is occurring. And also, if you think about intimate partner stalking, we tend to stereotype older adults as, you know, they don't have a dating life, or you know, they're not in intimate relationships. And those stereotypes take away from the complete reality that most definitely older adults are engaging in relationships and dating, and stalking can occur in those scenarios as well. So I just wanted to point that out, that even though the age range where people are more likely to experience stalking are at the younger ages of 18 to 25, that does not take away from the reality that this crime can be experienced at any age. Now, I talked a little bit about stalking behaviors, but the most common stalking behavior that is reported by stalking victims is unwanted phone calls and messages. That is the most common, and the rest of the behaviors that are listed on this chart are the more common types of behaviors that are reported by victims. So spreading rumors, which can of course be done through the internet as well, and using forms of technology like social networking. Again, there are more and more older adults who are on social networking sites, so that form of technology can most definitely be used in spreading rumors. Following or spying, that would include using any sort of GPS technology. Unwanted letters and email, showing up at places where the victim is, so either their home or their workplace. Waiting for the victim outside their home or outside their employment, and also leaving unwanted gifts. And I want to point out that most stalking cases are going to have some sort of technology being used, whether it's computer technology, cell phones, spyware technology. We see a lot of these different forms of technologies being used in stalking cases, and most definitely we can see technology being used in stalking cases involving older adults as well. Now, I want to now sort of focus on the intersection of stalking with other types of victimization. Stalking is rarely going to be found in a vacuum. There is a very strong intersection of stalking with other forms of victimization like domestic violence and sexual violence as well. Based on research that has been done in this area, most stalking victims who were stalked by an intimate partner also reported that they had experienced other forms of assault by that partner, whether it was physical assault, sexual assault, or both. So when you have an intimate partner stalking situation, in most cases, and it's highly likely that that stalking victim is also experiencing other forms of victimization from that intimate partner, whether it's physical violence or whether it's sexual violence or a combination of both. And it doesn't stop there. It doesn't stop with just domestic violence or sexual violence. We see a lot of other crimes that are linked to stalking behaviors as well. So for example, damaging the victim's property, breaking into their home, a direct attack on the victim or a violent attack on the victim, or attacking another person close to the victim, or maybe even attacking the victim's pet. We also see identity theft occurring in stalking cases, and again that brings in the technology piece where you have perpetrators who may have access to the victim's bank accounts, their passwords, or may even hack into their email or hack into their credit card accounts or bank accounts, steal their identity to process transactions or steal money for the victim or open or close accounts in their name. So with this research that we have, it's very clear that stalking is most likely not going to be alone. It's going to be involved in other types of crime as well. Let's just go back one slide, I apologize. Now, when we talk about how long these cases last, stalking cases are not cases that are going to happen overnight or end overnight. These are long, drawn-out cases. It makes sense because since stalking is a pattern of behavior, it's repeated behavior, it's a course of conduct, this behavior is going to go on for a long time. The average stalking case will last about 2 years. However, they can be much longer. Recently, there was a federal case that was prosecuted in Arizona, which was a stalking case where the victim was stalked for almost 20 years by the same stalker. So again, these cases do not end overnight. These are going to be long, drawn-out cases, and it's also because these offenders do not give up that easily. They will continue to engage in their behavior over a long period of time. And when we think about the duration of stalking and how long these cases can actually last, with the average case lasting up to 2 years, we can think about what type of an impact that's going to have on the victim's life who is involved. This next slide gives you just a sort of a flash of the different types of emotional and physical repercussions that victims report that they experience as a result of the stalking behavior that they are being put through. Most stalking victims will start out by minimizing the behavior and blaming themselves. Many will feel embarrassment or shame in talking about it or reporting, and that will lead to further isolation of the victim. And if you think back to what I said about how stalking behavior, those individual behaviors may not be illegal behaviors, the victim will also consider that and further minimize, because they will say, well, you know, this person's just calling me a lot or sending me a lot of texts. They're not really doing anything illegal. There's really nothing I can do about it. So that first reaction is always minimizing that behavior and not realizing that it's going to continue and it's going to escalate. One of the main repercussions that victims report is feeling anxiety, and that anxiety is as a result of really not knowing what's going to happen next. And in fact, when victims were asked what their biggest fear was when experiencing the stalking, is not knowing what would happen next, not knowing what the stalker's next move would be. And you can imagine what type of a toll that would take on a person day in, day out, waking up in the morning and not knowing what's going to be there in their email account, or not knowing how many messages or missed calls they're going to have on their cell phone and what the content of those messages might be. And this next quote that I'm going to put up for you, I think really does a great job of capturing that anxiety and that fear. It's not easy to describe the fear you have when you see the stalker or signs of the stalker everywhere you go. I have given up all hopes of ever having a safe life. For the rest of my life,
thanks very much,
I will be looking over my shoulder, expecting to see him there. And with that, I'm going to turn it over to Linda Dawson to talk about elder abuse.
Can you hear me?
Thank you.
Okay, great. I want to talk a little bit about elder abuse and about why it's important for us to understand the aging population in the context of stalking. As was indicated in the slides earlier, the number of reported cases or self-reported cases in older individuals is very less than what we see in younger populations. But that doesn't mean that it's not there or that it's not still a lethal threat to older individuals or psychologically as damaging to older individuals as it is to younger individuals. So I want to just talk about the aging population and what we're facing as time goes on. This is a chart that shows the expected population growth in the United States over the next 40 years. You can see that we're about in the middle of the chart at this point, and there's going to be an exponentially greater increase of people who are 65 and older as time goes on. That's in part because of the number of baby boomers that are out there, and it just is that people are living longer as well. So the number of people over 65 in the United States is expected to double in the next 2 decades, and they'll represent approximately 1 in 5 Americans compared to 1 in 8 today. And when we think about that, we have to think about not only the numbers that are involved, but also the services that are involved in the aging population and what that means in terms of responding to people and in terms of the services or systems that are involved in caring or protecting or intervening with those populations. The other thing to keep in mind is that, we've indicated that the number of victims are the primary, that women are the primary victims in these kinds of cases. And currently 25% of adult women are age 60 and older, and that number is going to increase as time goes on. Currently, people 85 and older are the fastest growing population group in the United States. And as I said earlier, our life expectancy is continuing to expand. It's expected that our children will have an average age of about 100, rather than, now, which is in the 80s, or compared to our grandparents perhaps, which was in the 60s. So why should we learn about elder abuse? Well, in part because there's going to be a lot of older individuals in the United States in the next 20 years. There are going to be more people above the age of 65 than under the age of 18. The other thing is that reported cases of elder abuse are increasing. We know that in the 90s, cases increased by approximately 62%, and that number has continued to increase as time goes on. The other thing that's happening is that as people become more aware of elder abuse and more aware of the forms of elder abuse, then there's an increase in reporting and figuring out where things can be reported, where cases can be reported. APS, Adult Protective Services in all states, is becoming the go-to agency for elder abuse cases, as is law enforcement or other aging services. Also, people are seeing elder abuse cases in a variety of contexts. So in a court system, for example, an elder abuse case can come in many different forums. It can come in a probate case, in a civil case, in a child protective case involving grandchildren. It can come in a criminal case, and it can come in a variety of cases, a variety of forums. Health care providers are seeing cases of elder abuse. Dentists are seeing cases of elder abuse. Long-term care providers, law enforcement, financial institutions, social service agencies are seeing these cases. So a lot of different agencies and a lot of different individuals and professionals are seeing cases of elder abuse in a variety of contexts. And it's important for people to understand the warning signs and the red flags so that people can respond appropriately to protect a victim from further harm or further loss. This slide is a slide that was prepared by the Lifelong Justice program, and it's a great slide that summarizes the results of the New York study that was done by the Weill Cornell Center and the New York City and the Aging and Lifespan of Greater Rochester. This was a study that was done in 2011 and involved approximately 4,000 contacts with older individuals. And the results of this study indicated that for every one case of elder abuse that came to the attention of a responding or responsible entity, there were 23 cases that never came to the light of that agency. So you can see from this iceberg slide that the issue of elder abuse is very much larger than what we are aware of. We're aware of a very small number of cases, and there's a large number of cases that are out there. In the people that were contacted in this study, the predominant form of mistreatment or maltreatment was financial exploitation. 1 out of 25 individuals reported some form of financial exploitation in the previous year, followed by physical abuse. 1 out of 50 reported some form of physical abuse in the previous year. And then that was also followed by other forms of abuse, sexual assault, neglect, etc. So it's very likely that many of us are having contact with victims of elder abuse and we don't even recognize it or know it. And so that's why it's important to make sure that we are talking about elder abuse, talking about the forms, talking about how it presents, so that we can be aware of and help respond to cases of elder abuse. The other thing about elder abuse cases is that because various systems are involved, it's important that we approach this in a multidisciplinary fashion, because if we're not coordinating or collaborating with other agencies that are involved with older individuals, then information is lost, there are gaps in information that we have, and then services may not be appropriate because we're only operating from our narrow silo of information. So it's really critical that multidisciplinary systems respond to these kinds of cases. The other thing that's important is that for older individuals who are victims of maltreatment of all forms, the injuries are much more significant. The injuries, physical injuries, take longer to recover from, and in many cases, victims never fully recover from the injuries that they experience, that they incur. And the financial losses are so significant for older individuals, and many victims never fully recover from the financial losses that they incur. We need to keep in mind that not only is there an importance or the need for multidisciplinary team responses to these cases, but we need to be also thinking about cases that are occurring in long-term care or residential facilities as well. When we think about stalking in those kinds of settings, those are settings where individuals are living in a setting where, because of their physical or cognitive limitations or their conditions, one example of stalking in that kind of situation is a resident who goes into the room of another resident, and that resident really has nowhere to go. So these are resident-to-resident kinds of offenses that are occurring. There's no place to go. One resident would have to be transferred to another facility, and sometimes there aren't other options available for that resident in other places. So we also need to be thinking about the context of the living situation for older individuals, as well as making sure that we're dealing with identifying the cases that come along. So elder abuse, the way we talk about elder abuse is that it is when an older individual experiences physical, sexual, emotional abuse, neglect, or financial exploitation. Often these cases involve another person doing that or causing that consequence to a victim. And as was indicated earlier about the stalking behaviors, these forms of abuse co-occur in most cases. We're hearing that financial exploitation is reported most often. I think it's because people are more comfortable talking about financial exploitation. They can recognize it, they can identify it, they can talk about it more easily. There's something that they can grab onto. Whereas physical or sexual abuse or emotional abuse or neglect are often things that people make excuses for or don't want to think is really happening. And so they sort of go into a denial about talking about it. And so it's harder to identify. But in the cases where there's financial exploitation, there is very often co-occurring neglect. There may be self-neglect or evidence of self-neglect that really is the result of financial exploitation, and the person is not getting the information that they need. and then the physical and sexual abuse that's occurring at the same time. The victims of elder abuse are generally over 60. In our program, we focus on people who are 50 and older because we find that at age 50, many of the services tend to start dropping off for victims. And so, but in many states, the laws involve individuals who are age 60 or older. Each state law is different. The gender of elder abuse, again, is the majority are females. Some are males, as with other statistics. We're seeing increasing numbers of male victims in these cases, especially in financial exploitation. It occurs in all religious, ethnic, and socioeconomic and religious backgrounds, and it occurs in heterosexual and LGBTQ relationships as well. This abuse may have occurred over the lifespan or the relationship of this person. It may be new to that relationship, or it may be due to a change in a person's medical condition or due to their medication that they're on in terms of interaction with their medication. So there are many reasons that this occurs. Also, it includes dating relationships, and in stalking cases in particular, it occurs long-term friendships of older individuals. I'm aware of a case where two couples had been long-term friends. The wife of the one person died, and the husband of the woman died, and they continued to be socially friends in the long-term care setting that they lived in. And that relationship became more complicated when the man began to want a more intimate relationship, and the woman didn't know how to end his advances without hurting his feelings. And so it can happen among long-term friends as well. The perpetrators are most often family members. They include adult children, stepchildren, grandchildren, siblings. It also includes intimate partner violence. And it includes caregivers, both volunteer caregivers and paid caregivers. And perpetrators are also people who are in positions of trust. So it could be accountants, physicians, clergy, powers of attorney, guardians, anybody who is in a trusting relationship where the victim trusts that the person is acting in their best interest. Older individuals vary in their capacity. Some are healthy, some have medical or cognitive conditions, some are active, and some are less active. And the issue that we have in identifying and responding to these cases is that no victim is the same, and we often enter these cases with our own preconceptions about what that person is like. I'll give an example of my parents. My dad is 88, my mother is 86. They golf, they're very active. Recently, my dad was hospitalized for gallbladder surgery, and he was treated in the hospital as if he was a senile and infirm patient, as opposed to an active, independent 88-year-old man. So, we have to understand that people who are approaching older individuals are approaching it with their own biases and their own preconceptions about what a person is like or must be like in those cases. And stalkers use that to their advantage in dealing with victims because they tend to prey on the fact that the person can be viewed as confused, or that they're making this up, or that they have dementia, or whatever. And so, those are the kinds of things that we want to keep in mind when we're dealing with and responding to these kinds of cases. So where do you think elder abuse occurs? If you could use the feedback box, select one of the options.
Hi everyone, I just want to jump in and say please use the feedback box to choose the button, and don't use the chat box so that we can compile it all. It's fine to use the chat box, but please also use the feedback box as well. Thank you.
So the majority of people are indicating that it occurs in all of the above settings, the private residences, public settings, facility settings, and that's true. In most of the advertisements that we see on TV or the billboards focus on abuse in facility settings, but that represents a very small number or percentage of the cases that we see. Most of the cases are occurring in private residences. And it occurs in the community and public settings and in facility settings as well. So it's important to be looking at all of those places. The issue of when things are occurring in private residences is that it's much harder to identify and it's harder to intervene if the older person is being isolated by the family member or the caregiver. Elder abuse occurs because of these two reasons: power and control, the classic dynamics that we see in domestic violence kinds of cases, and greed. The motivations are similar to what we see in younger cases. The National Clearinghouse on Abuse in Later Life took the Duluth model of the power and control wheel and gave it to older victims of abuse in later life and asked them to talk about their experiences with abuse in later life with their perpetrators. And they identified that there were some similarities, but there are many differences as well. And this wheel represents what older victims experience in abuse in later life. So as you can see, the physical violence and sexual violence threads are on the outside of the wheel. The victims indicated that emotional abuse and psychological abuse permeated everything that the perpetrator did, with power and control being the dominant factor in the center. Some of the differences are the isolation that perpetrators use with older individuals. As older individuals, as people age, they often become less visible in the community. So they may not go to church as often. They may have fewer friends because their friends may have died or moved away. So they become naturally more isolated, as opposed to younger people who are going out into the community more often as they get older. And people buy or accept the excuse that the person is not feeling well or is suffering from some form of dementia or has health issues or mobility issues that a caregiver gives to keep people away, so that older individuals become increasingly isolated as time goes on. Another strategy that perpetrators is to use family members, saying, if you don't do what I want you to do or give me this money, then you're not going to be able to see your grandchildren, or we're not going to be able to see you. I'm the only one who really cares about you, things like that. The perpetrator also targets the vulnerabilities of the person, taking advantage of their lack of mobility or maybe their diagnoses of early onset Alzheimer's or dementia. So these are some of the things strategies that are used. The other one I want to focus on is the threat. Perpetrators will often use the threat of having to go into a nursing home as a threat to keep a person under control in their own home in an abusive situation. And we all know that many people don't want to they say they don't want to go into a nursing home. They'd rather live out their lives in their own home. So that threat is very real for older victims as well. I mentioned earlier the importance of coordination and collaboration among multidisciplinary agencies. So these are some of the agencies that can be involved in cases of elder abuse. And it's important to know that each of these may be doing their own investigations. Each of these has their own responses. Each of these has their own rules about how and when they can become involved. And it's important that we close the gaps between the puzzle pieces so that there are not gaps where victims can fall between the cracks. We want to make sure that that no matter where a victim enters a system, that there are no locked doors or no wrong doors for victims to enter. And that if a victim enters, for example, through Adult Protective Services and needs the assistance of an advocate, that APS can assist that victim in getting the services of an advocate. So it's important for people to understand what the other players are doing and the roles that they have, and to know who they can contact in those situations to make sure that victims get the services that they need. Elder abuse can, just like when we talked earlier about the stalking, elder abuse can be difficult to identify because of these factors: shame, embarrassment, intimidation. You know, they don't want to be viewed as not being independent and being able to care for themselves. They may try to minimize or not identify things that are going on with them as a result. And our own stereotypes about older people contribute to a misdiagnosis or misresponse to these kinds of cases. Some of the challenges that are present are that, that physical abuse may decline because the perpetrator, especially if it's an intimate partner, the perpetrator may become weaker, for example, or less physically strong as he or she gets older. But the thing to keep in mind is that older perpetrators use other weapons or other tools to keep the power. The other thing is that as people provide care for each other, it brings the victim into the proximity of the perpetrator, to providing assistance with daily cares or medication or things like that. So even though the physical strength may diminish, the physical abuse and the emotional abuse and the power and control tactics are still present. And then again, the isolation is critical. People just sort of are looking the other way in these cases because, especially in cases where there's been a long-term relationship involving domestic violence. There's also a lack of training for many advocates in working with older individuals, or shelters may not be in a situation, may not be set up to be able to serve older victims, especially older victims with health care or mobility issues. And finally, the victim may be, as I said earlier, may be responsible for caring or financially supporting the perpetrator. And that could be if the perpetrator is an adult child who doesn't have a job and who's living with a parent or a spouse. Another factor in this is that a victim may have sought assistance early in life from one of the systems that were identified on the slide earlier, the puzzle piece slide, and may not have had a good experience with that agency. So the victim is now reluctant to go back to that agency or rely on reporting this to another agency because they haven't had a good experience in reporting in the past, which serves as a deterrent for future reporting. The final additional challenges that we've identified are a lack of awareness and training for law enforcement, for prosecutors, for judges, for civil attorneys, for healthcare providers, for advocates, for a number of people. And so it's important that we try to expand the amount of training that people have available to have them identify the warning signs, identify how things co-occur, and what can be done in these cases. And then we also want to make sure that some of the myths about abuse, and I would say caregiver stress is one of the myths, that caregiver stress causes elder abuse, is one of the things that we want to identify to make sure that we talk about that if you say that the cause of the abuse is because the caregiver is stressed, then the focus of the remedies is on the caregiver's behavior and the caregiver providing assistance to the caregiver and not providing assistance to the victim, which doesn't make the victim any safer. What we're going to do now is start talking about some case scenarios. When we put out the advertisement for this stalking webinar, we asked people to send me some case scenarios or case examples, and I received several, and I really appreciate, if any of you are responsible for sending me case examples, I really appreciate the examples that we received. They were very powerful, and we're only able to use a couple of them today because of our time, but we will be using them in other trainings that we do. So what we're going to do is move to the first case scenario, and Hima's going to talk about that one.
Okay, so so I'm going to go ahead and read the first scenario, and we're going to have some questions after it. I just wanted to say that at some point, Linda, if you want to jump in, just use the chat feature to let us know, and we'll unmute you, so you can also contribute anything you'd like to say. So the first case scenario, I'm going to read it out loud. A single woman, approximately 70 years of age, reports to the police that items had gone missing from her apartment where she resided alone. The items weren't of any substantial monetary or personal value. Over time, various items, sometimes as little as a piece of paper, went missing. At times, objects appeared to be moved around, but nothing was reported missing, and there were no signs of forced entry. So I'm just going to leave this up for just a couple of seconds so people have a chance to review it, and then we will move on to the questions. Okay, so let's move on to the following question. What are some of the challenges that this victim might face? And if you could please use the chat feature to type in your answer. So again, what are some of the challenges that this particular victim might face in this scenario? And she is in her own home. Okay, so it looks like a lot of people are answering that the victim in this case might be perceived to have dementia or memory loss because of her age. So it might be a belief by, let's say, if law enforcement was contacted, there might be a belief that maybe she's just forgetful and she just can't remember where she put things. And some people are saying that there isn't any proof that an actual crime occurred. It's just a case where things are being moved around. Some things did go missing. So that might be proof that some kind of a crime occurred, because certain things did go missing even though they were not of monetary or personal value. And some people are saying that police may not see this as a priority. Absolutely. So thank you so much for all the feedback and your comments. That you all recognized some of the challenges that this victim most certainly is facing, and the challenges that we recognize. And the first is, of course, that an older victim, there's that stereotype or that preconceived notion that if a victim is older, and in this case around 70 years of age, that they're forgetful, they're confused, they may lose track of their belongings or where they put certain things. And again, as someone mentioned, that there was really no threat or real harm done in this case, whereas nothing of any major value was removed from the home. The victim did not suffer harm, whether it's physical harm or emotional harm in this situation. And as some other people mentioned, that it just sounds crazy. It just sounds like, that again, that preconceived notion that it's an older adult who, just as confused and has forgotten where she's put things, and it's just sort of a crazy situation, and it's completely unbelievable. Well, in actuality, since this is an actual case that occurred, this victim actually reported the happenings to law enforcement, and a detective actually requested that a hidden camera and a clock radio actually be placed in the residence to survey the residence and to see what's going on. Within about 2 weeks, the surveillance footage actually revealed that a man who had previously done work for the victim as a handyman in her apartment, he had somehow gotten access to a key to the victim's apartment while he was working there, and the surveillance footage showed him using the key to enter the apartment, and somehow he was going around in the apartment for periods of time looking through the victim's belongings, moving things around, moving things from the apartment. And the outcome was that this individual was actually charged and arrested and charged with the appropriate violations of law. So clearly in this case, it was not a situation where the victim was just confused or forgetting. This victim was actually being victimized by an individual who she knew, who had had previous access to her apartment, and who had taken full advantage of that and gone back in and was going through her belongings. Now, Linda, do you have anything you'd like to add to the challenges
no,
that we're
you
talking
covered
about?
all of the ones that I was going to talk about.
Okay, great. So then let's go on and move to the second scenario.
So the second scenario involves Sylvia, who is an 85-year-old woman who was terrorized with a gun by her husband after enduring several years of accusations and threats. The authorities found dozens of guns hidden around the home. Some guns were loaded and marked RPG or ready to go. He was arrested, convicted, and given probation. And he was ordered to have no contact with the victim. The client has just filed for divorce after 60-some years of marriage. Recently, the defendant has been observed by the victim to drive by the home where she resides. So this is our scenario that we'd like you to think about. And then what we'd like you to address in the chat feature are what are some of the challenges that this particular victim faces. So many of you have identified a lot of the concerns that we had with this case and others. I think it's great to see that you're identifying the issues of proof or documentation. You know, this is a case where she's observing him drive by. How does she prove that he's driving by? You know, is there a legitimate reason for him to be driving by her house? For example, is it on his way to some appointment that he has to have or something? Is there a way to, you know, older victims in this kind of case may not be perceived as dangerous, which we know is just not the case. Older offenders are very dangerous, and often their dangerousness is underestimated by law enforcement and others who are dealing with these kinds of cases. And so, you know, just how dangerous he is known to the victim. And you've identified in your answers that fear is a real challenge for her, our response for her, as he continues to terrorize her as he drives by. The other thing is that, we have to figure out what's the safety plan for her. She's living in her own home. He's driving by. How do we safety plan around her? The traditional options for victims may not work for her. She may have medical issues or mobility issues or other issues that prevent her from being able to access or use a traditional domestic violence shelter. And relocation may be financially difficult for her to move out of her home and move to a different location. Lots of you have identified some, what we want to talk about next in this case, which is what else could you do in this scenario? What other options or resources would you provide to her? Some of you are indicating restraining orders. What are some of the other options that we could be using to assist her in this case? I like the fact that a lot of you are indicating support groups for her. I think that's really important for older victims in particular, that support groups are very helpful for older victims so that they know that they're not alone. They can talk with other people who have those same experiences. I think developing a safety plan for her is critical. How do you develop a safety plan for her in this scenario? Using a restraining order is another option. However, in the state where this occurred, I was told by the person who gave me the case that they only have protection from abuse orders, and it was not available to her in this case because the primary violation occurred, months before the drive-bys, and without physical contact, she wasn't able to get a protection order. So I think that highlights the need for all of us to be looking at our laws in our own states about the use of protective orders or restraining orders and what the language is for cases like this. And to get on a restraining order or to get a restraining order early on in a criminal case, because although a bail condition may be set and a condition of probation may be set upon conviction that prohibit contact, those terms are only as good as, only last as long as the criminal case lasts. And later on, the victim may not be in a position to get a restraining order because there may not be enough recent behaviors to pass the threshold that's required to get the restraining order or the protective order. So again, it's really important for prosecutors and advocates and people involved in these cases to make sure that they think about getting a restraining order, even though there may be other protective orders or conditions in place early on in the criminal case. And I agree with some of the comments that people are making that protective orders are pieces of paper, but when you have a protective order or a restraining order, it's easier for prosecutors to prove those cases and get convictions on those cases than it is in some other cases. And especially if the victim in this case was able to film him driving by her house, or if there was another witness who observed him driving by her house, and there was a condition on the restraining order that he not be within a certain distance from her residence or on the street where she lives. Some of those things can be done in restraining orders depending on the state and depending on the law. So, I think that one of the things that we can all do is look at our restraining orders in our states and make sure that they address the kinds of situations that are coming up in these kinds of cases. Another option here is reporting it to the probation agent, and in this case a report was made to the probation agent, but the reporter to us indicated that it takes a lot before a violation hearing is scheduled. And so again, it's sort of hitting that threshold and having a probation agent understand the impact of one drive-by for this victim in that kind of scenario. So, you know, education for probation agents to understand stalking, the impact of victims, the kinds of behaviors, the risk of, you know, the threat that is occurring in that kind of situation, and the terrorism that the victim experiences is important, as well as, so it's educating probation, educating the courts, and educating other people as well. The victim could also go back to court and get a revised, seek a revision of the conditions of probation. You know, if there's new behavior, the drive-bys, then perhaps the judge would entertain revising the conditions of probation to ensure that he not be on her street or not have any, not be within a certain distance from her home. Somebody just mentioned getting Lifeline or some kind of alarm system in her house, and that's another option. A lot of times victims have alarms that law enforcement can put in their home, so that if there is a particular emergent situation, they can push that alarm and there'll be a law enforcement response quickly rather than having to go through 911. So those are some of the options that we thought of as well, and I'm really glad to see some of the ideas that you had on the chat line as well. We want to close out by talking about what resources would be helpful or useful for you when working with victims of stalking in later life. So we'd like to hear what would be helpful for you. And Hema, if you have anything to add, please jump in here.
Okay, great. Thanks, Linda. Yeah, I just to kind of follow up on the last case scenario that we discussed. A lot of people were mentioning safety planning, and it's really great to hear that. And I think hand in hand with the safety planning would be a threat assessment of the situation as well, because clearly this was a situation where it sounds like there were threats and possibly even violence occurring during the relationship. He clearly had access to weapons, may still have access to weapons. So I just wanted to put that in there is sort of doing the lethality assessment of the situation, go hand in hand with the safety planning. And of course, doing that same threat assessment and safety planning around if she were to get an order of protection, that could possibly be a trigger to escalate his behavior as well. So just keeping that in mind when doing the threat assessment and safety planning as well.
You know, one question I'll ask out there is, how many of you have coordinated community responses focusing on elder abuse that you are engaged with? So it looks like the majority of, well, about half of you, a little bit over half of you don't have a CCR. You know, and that is really something that can be beneficial for communities in dealing with elder abuse cases and developing and identifying where the gaps are, where the barriers are for agencies working in various states. You know, when we talked earlier about shelter options for older individuals, you know, it's important to have emergency shelters for victims when they need to be taken out of a dangerous environment. And, you know, for older individuals as well, one of the partners in that case is long-term care, because if people do have medical issues or cognitive issues, and their caregiver or their primary caregiver is the one who's being arrested or taken out of the home, then there needs to be a place for that person to get assistance. And partnering with long-term care and developing emergency shelters within long-term care settings is really important, and that can be done often within a CCR kind of setting. I agree that shelters are not generally set up for older victims. They're very chaotic often. They're really set up in most part for younger women with children, and that can be very stressful for a lot of older victims. So, and also there's accessibility issues for some of the shelters that we're aware of. So it's important for all of those things to be dealt with, as well as someone just mentioned that older individuals often have pets that they find that are important companions and supports for them. So so it's important for us to develop those options for older individuals, and that can be done often with CCR kinds of settings. Dealing with transportation, dealing with increased isolation, dealing with lack of access to resources can also be barriers for a lot of older victims, and those again can be identified and worked on in a CCR setting. We've seen lots of really amazing resources being developed through some of the coordinated community response teams that have been developed in communities across the United States. And so I would encourage you to either expand an existing CCR or develop a CCR in your community to start addressing some of the barriers and the gaps that may be existing in your community.
Thank you so much, Linda. It looks like we have about 10 more minutes, so I'm going to open it up to questions. So if you have a question, please enter it in the chat box, and Hema and Linda will be able to talk to you about it. Thank you. And while you're typing out responses or thinking of questions that may have come up for you, I just want to say thank you to you all for the work that you do and for participating in this webinar to learn more. We will have the recording posted on the Stalking Resource Center website, which I will enter into the chat box in just a moment. You will also receive a follow-up email with a PDF of this PowerPoint presentation, as well as a link to a SurveyMonkey evaluation of the webinar. We do take your feedback very seriously and incorporate it into our future training. So it's very short, just a few questions, so please take some time to answer that when you do receive that link. And Linda, I believe there's a question for you about your agency provides direct service or technical assistance for abuse and later life victims.
We provide technical assistance to communities and to agencies that are working on this area. We don't provide direct services for victims, but we try to link people to services in a particular area.
And when providing stalking support to victims, what would you consider to be the most effective strategy?
Well, developing a safety plan and working in a collaborative approach with agencies that can provide support to victims.
Yeah, I just want to kind of follow up on providing support to stalking victims and what would be the most effective strategy. Definitely, as Linda said, a coordinated community response is really essential in dealing with stalking cases, because you really need that cooperation between law enforcement, the prosecution, judges. You really need advocates, of course. You really need everyone on board to provide that support system for the victim. And also, many stalking victims, as I said, that the first feeling they have is of complete isolation. And many stalking victims, most will not report because of embarrassment, because fear that it won't be taken seriously, or because they are just minimizing, they're not recognizing this as stalking behavior or not knowing that this is actually a crime. So really decreasing that victim isolation, believing that the behavior is occurring, listening and believing the victim, and again, just having that CCR, coordinated community response, in place so the victim has all of the support they need every step of the way throughout their case.
One thing I'd like to do is sort of put a plug in for anybody who is interested in doing participating as a grantee in the Abuse in Later Life project. The Office on Violence Against Women currently has a grant opening now, so that communities can apply to receive the grant to get abuse in later life funds. And that would include providing training for law enforcement, prosecutors, judges, advocates, aging and APS agencies. It includes money that can be developed for direct services for older victims, and it includes the development of a coordinated community response team. So it's really a wonderful grant opportunity, and if people want to know more about it, they can go to our website and see more information about the Abuse in Later Life project.
Okay, so there was another question. What is the best way to educate judges, magistrates, and lawyers regarding stalking involving the elderly? And really the best way is just more awareness, more training. There really is just stalking alone, there is a lack of understanding and lack of education about the crime. And one of the reasons is that stalking is relatively still a new crime. The first stalking statute that outlawed stalking actually was not enacted until 1993. And that was done in California. So California was the first state to actually make stalking a crime. So this is still relatively a new crime. There's still a lack of awareness and education around it. So really the way to do that is just more training and more education to judges and prosecutors and magistrates to get a better understanding of the dynamics of this crime.
Okay, once again, thank you all so much for joining us and for doing the work that you do. There's still a few more minutes remaining for questions. If anything comes up, we'll stay on the webinar. And keep an eye out for the email coming your way with the evaluation link as well as a PDF. If there's any questions that you have that come up, you can reply to that email or send an email to me, and I'll do my best to help you or direct you in the right direction. And also check our website, victimsofcrime.org/SRC, to see if when the recording of this webinar is posted. And I also want to say a big thank you to Linda and Hema for their valuable information and all the work that they do. So thank you both.
Well, thank you to everybody for joining us and participating and being interested in this topic. It's very important.
Yeah, I'd also like to thank all the participants for all your participation, for joining us, for the great work that you do, and for also asking great questions as well.
There's a question about what the procedure is for educating judges. One of the MCJ, FCJ, I can't remember that organization right now. If people want to email me, I can send a contact about judges training, where there's specific training done on elder abuse, including stalking and specific training on domestic violence. So we can provide. I can provide that information to you, and I can provide additional information about law enforcement training if people want to just send me an email. My email is ldawson@wcadv.org. Laura just put it up on the chat line.
And the Stalking Resource Center is also funded to provide training, so you can go to our website and download our training request form and either email it or fax it to us, and we'll see if we have a trainer available for that date, can get to that location, or if there's someone else that we can refer to you to contact about a training in your area. So that information is on our website as well. We also have an online course, The Use of Technology to Stalk, which you can visit at techtostalk.com. And that's a really great resource for advocates and law enforcement officers especially. It goes into details about collecting evidence, especially when technology is being used. It's not specific to stalking in later life victims, but more broadly about stalking in general, but another tool for law enforcement training. Okay, thank you all so much for joining us. And don't forget to check our website for the recording if there's anything that you missed or anything that you want to go back to. And look for an email with the PDF. And let us know if you have any questions. Thank you all so much for joining us.